week of action for the census. I should have had a slide on that, but that would have eaten into the budget basics time. So, but if you haven't done the census, or if you haven't heard, if you are in a residence or you have a family member in a residence and you haven't heard that people have done the census yet, it always doesn't hurt to check in on that. Chapter, I would say we had phone calls to chapters and all of them seem pretty familiar with that, and a bunch of agencies that are not chapters seem very familiar, but here or there might be people that miss it. So
okay, all righty, so it's noontime, Leo, and you got about 42 people on, and I bet more will be joining, but I think you're ready to go.
All right, it's a pleasure to be with you, and it's the 27th of July. Happy summer. I'm sure it feels like a regular summer to all of you, you know, but I'm happy to be with you, and it does feel like an odd summer. The House Police Reform Bill got an amendment last week. Thank you, Maura, for your hard work on it, but Paul Tucker, who's a rep and had been working on this with a number of other representatives, were able to get it into the police reform bill, the training for police for individuals with intellectual and developmental disabilities, including autism. As you know, obviously the police reform bill is based around Black and Brown Lives Matter, which is a huge issue. And, you know, given the lack of equity for people with disabilities, the question was, could this be part of that as well? And it is in the House bill. It's not in the Senate bill. I'm sure they're both great bills, and we'll hopefully be able to see it carry over. But I just want to say that it just happened last week. So we're working on other things as we're, you know, doing this COVID stuff too. So life goes on. So today's session is a two parts. Today's part one of budget basics, because we want to really drill it down. Next week we'll do some drilling down today, but it's really a 2-week topic, honestly. And we're going to talk about the big picture funding of DDS and Mass Health today. We're going to talk about the service or supports that are funded that you know about or don't know about, as the case might be, and the differences in the programs and funding. And then, as I shared a little earlier, for those of you that were on, we're going to have our special guest, which I'll introduce at about 12:30, and about COVID-19 update and reopening. So looking forward to that. And as the state reopens, right? So, okay, I don't know why I'm having trouble with my cursor. So I got to drop this picture so I can see, okay. So here's an example. This isn't the way the budget looks like in the formal state budget. This is how we present it to you, but what you're seeing here, that's interesting. I replaced this with something else, and I'm showing you an old one. Okay, that's great. I had replaced this. Carrie, don't send out the one you have because I want to update. This isn't bad. This is like pretty close to the budget we had, but this year, if you'll recall, what we had going on before COVID hit was a big rate increase. And what you would have seen, this chart's fine, but what you would have seen would have been the line items that we had posted besides fighting for a rate increase. The governor had put in $160 million for rates, and I'm going to explain that in a minute. But let's look at these line items. This is the DDS budget chart. And basically, I'm showing you several line items here that include respite and family support, DESE, which is a small program for kids up to 22, actually youth. You know, many times the youth transition to adult services even before 22. But it's to help with complex behavioral conditions. Family support, of course, you're familiar with, I hope, but it's for individual families. Basically, this is in the state budget. These are in paragraph form in the state budget, and then we produce them. And you're going to see a paragraph form when I show you the Mass Health line item. And they might have inside language in it, which also says how the money can be used. But if you look at the money, like Community Day and Work, it's actually, in 2020, it was more like $220 million, okay, just to play it out. This was the final money in 2019. 2020 was the year that just ended with COVID. And a lot of the budget was, once we were into March, April, May, June, things had changed and they had to make adjustments in the budgets because residential programs had more staff during the day. Day and work programs were closed. They had to figure out a way that day and work programs could get reimbursed or funded because they couldn't bill for people in the program. But the state budget, pretty much the legislature controls that. The governor gives a recommendation, the legislature controls it, and other line items that you're not seeing here are Autism Omnibus, which really I treat equal to community day work and community residential, because it's for adults with developmental disabilities and autism, whereas community day work, community residential, and the other adult services, they are for adults who have an intellectual disability along with perhaps autism. Maybe they have Down syndrome, maybe they have cerebral palsy, but they have to also be diagnosed with an intellectual disability. Autism Omnibus allows people with developmental disability and autism to be funded. And as you know, this past 2 years, there's been efforts to broaden that population to include people with cerebral palsy, people with fetal alcohol syndrome. And that obviously in a tough budget year like this, if it happens, I'll be surprised. It would be great, but it's a tough ask this year. Hopefully things will get better, our economy will get better, and that will be something that will happen in the future. But the other thing, these budget line items, they correspond to your individual allocations. And next week, when we talk about, how that funding breaks out in a program, that means basically when you get funded, unless you pick self-directed services or your family member picks self-directed services with individual budgets, your budget is tied up in a group budget. And an agency, to perform its work, whether it's employment or day program and mass health program, they have to think about, okay, we're serving X people. How do we serve them with quality and effectively, okay? The second question is, when that money is allocated, how does it address salaries and fringe benefits and all the basic costs? And we're going to talk about that once I give you the overview. But so it's like your house budget. You have a certain amount of money. You decide how you're going to break it up. In the case of this funding, the state goes through a budget process. They decide how much money they have. We push for more. You never for less, obviously. Sometimes we push only for more in certain areas, right? Because you're only going to get a yes in a few areas. And then we go back and hope to make a difference through that pushing. And organizations can serve either more people or they can pay staff higher salaries. And we'll come back to that. Oh, there it is. I guess I just didn't throw out that line. There's the request for 2021. I probably wanted you, I guess, to see that. Geez. Family support and respite. So let's just go back and forth for a second. That's 77 million, almost 78 million. It was 65 million in 2019. Okay, just to give you a flavor, take a look at community day employment. And our ask was 253, almost 254 million for 2021. And it says here in the 19 budget, it was 210. Okay, now take a look at Autism Omnibus. It looks small compared to that, but remember, this is a brand new program. The law passed in 2014. It didn't become real till 2015, 2016. That's almost 40 million. And in this budget, the governor for 2020 had actually allocated up to 8 million as well. Both family support got 7, Autism Omnibus got 8. And then community residential, look at that, $1,287 million. And that is because that's 24/7 services, right? Serving right under 8,000 people across the state. And we'll talk about that and the funding as well. But just to give you an example, for the first time, if you see as a technology innovation budget proposed, that was before COVID. That was before all this virtual programming. What's not here was a request for the residential workforce. There was 160 million the governor had put in the budget. And we had, as you know, we had a campaign where we really wanted to see direct support salaries go up considerably. And basically, the least we felt it could go up would be 10%. And separate from the allocation, the state then decides what the rates are for residential programs. And again, we're going to come to that after we go through mass health. And that was something we were saying, well, geez, there's 160 million, but it's not just for residential services. It's also for DMH. It's also for Department of Youth Services. It's, how are we ever going to get 10% out of 160 million? Because that's probably $125 million alone just for DDS if we were to get that minimum target of 10%. We'll come back to that. And so there's both like how much funding people get so they can get services, but then it's about, is that funding, the amount of money per person, really reflect what you need to pay? Or do you need to change the service model to be able to pay more? And if you change the service model, here's the rub. When you get services for day unemployment, for some people, you're hoping to have, if you can't work full time, you're still hoping to have some kind of day activity. And so that means you have to have a certain number of hours covered. Well, the tension there is to have those certain number of hours covered. And if we're not getting enough money to pay the workforce what we need to, how do we get there unless we ask for more funding? If we can't get more funding, the only way you can get there is by changing the way you deliver services. So COVID actually, and the disruption, except for the terrible thing about how it hurt people and caused some people to die, might force us to take a fresh look at things around delivery services for those people that don't need all those hours during the week, but do want a quality support from staff and from programs. And then you have the same thing happening in community residential, where for some people they need 24 hours a day, 7 days a week help. Those people you can't just say, okay, we're going to pay more and you're only going to get, 12 hours a day of help, 5 days a week. But you know what? We're going to give you a really good staff because of that and train them well because now we have adequate funding. So, we've got all this during COVID. I know it's something that was on the top of our minds literally up to March 19th, 18th, maybe 15th, and then the world changed. But so when you look at these budget numbers, you're thinking of the number of people, you're thinking of then how that translates into what people are paid and the other costs organizations have. And if you're in self-directed services, you're thinking of what you have to pay and then what other costs you have in your life to make things work or your family member's life. So let's do one more thing before we switch to mass health. Community day unemployment, there's right about 10,000 people reflected in that 254 million. And what we also don't know sometimes, some of these line items, there might be some staffing paid for as well. So it's a new program like Autism Omnibus, Autism Children's Waiver. There may be some staffing paid for through that. In family support and respite care, I know for a fact, unless it just changed a few years ago, that clinical teams that were working at state-operated residences were paid for through some of the money. And at the time when we had less money, it seemed like a lot of money was going for those services that wasn't really family support and respite. It was a good use. It was helping people in community residences that were operated by the state, but it seemed like not the right use for that line item, if you get my drift. In terms of turning 22, 1,300 people will be turning 22 this year. That line item is 25 million. Again, a big plus for Governor Baker and Secretary Sutters. Just wonderful that they tripled that line, more than tripled that line item some years ago. And then what happens is community day unemployment, residential, every year that number stays the same, 25. I'm pointing to the screen as if you can see what I'm pointing to. Every year that money, once it's spent, for the next year, the people that were funded get funded through whatever service they got. So if John Smith lives at home and John got turning 22 money for employment and some day services, and John will next year get funded through the Community Day Unemployment Program. If Mary Jackson got funded for community residential and day unemployment, Mary Jackson's funding is now in community residential the next year in day unemployment. So all these line items have to grow to absorb the funding that turning 22 made happen in the year those folks turned 22. So it sounds complicated. It's really not. It's simple arithmetic. You have a baby, a new person in the house. You're either going to have to earn more money or you're going to have to spread out your dollars more among your family members, right? It's pretty much, that's the way it goes. And or you're not going to go to that play you like to go to once a month, right? You're going to make different decisions about spending behavior. We'll take some questions. after I describe mass health, if you have any, because I realize I'm shooting a lot at you. And so you saw the range of services in DDS, in mass health. The Office of Long-Term Supports have services like PCA, FC. I'm going to move the page for a second to show you those. Okay, sorry for the gray they have in purple. I guess, someone should have taught me aesthetics growing up. But personal care attendant program, adult family care or foster care, day habilitation services, which is an alternative day program that includes health therapies, allied health therapies, continuous nursing I focus on versus home health, though some of our folks do get home health services, I'm sure, and then durable medical equipment. Those are, I'm highlighting the big ones. There's obviously adult day health that some of our constituents also attend. That's there as well. I'm giving you examples. So the question you might ask is, geez, Leo, why is there day services in DDS and then day habilitation services in mass health? Why are there two agencies providing sort of similar services? Well, they're similar because they're daytime. They're actually very different services. Community-based day supports, that's the primary day support, separate from employment, is more of an integration. It's sort of up to date with the new philosophy about people with intellectual and developmental disabilities, that it's not just thinking about what supports they need, it's also thinking about their goals in life, right? All of us want to have goals in life. We want to feel fulfilled. So CBDS really meets that challenge, and really is attempting to. Again, funding is always a rub. Having great staff is always a rub. It's important, right? But in day habilitation, it's really intended for people who also need help around maybe, muscles and walking and being able to be stronger in their activities of daily living, getting into, maybe they need assistance to eat their lunch, and that doesn't mean people in CBDS don't have some of those same needs, but in day habilitation, that's more of a focus. There's less integration, though the goal for integration is really for everybody, not just for those going to CBDS. So that's that example. And I went into that example because, again, it shows you the sort of tapestry of services and how they all interrelate. Mass health and DDS services work together to provide the community supports people need, and honestly, I would argue, have a right to in our society, for them to have an equal chance on the playing field of life, okay? And these services are essential. And then let me just go back one. These are the line items, and I'm going to show you a line item in a second that they could come through the money. In the old days, when we advocated, when there was a big cut in day habilitation, we had literally 4 line items. It is very confusing to look at these line items because they are huge. 0700, which is, I would argue, the core line item, though in the old days I was told it was 0600 and now 0601. It is $2 billion and change, almost $3 billion. Let's take a look. So you can't really figure out, like with the DDS budget, what's what, right? Here's an example of a line item, whether DDS or mass health. Here's the 4,0700 line items, $2.874 billion. If I round it up, I should round up and say 2.875. Mass health is the biggest part of the state budget, by the way. DDS, I call as a mini mass health because its budget is over $2 billion. Mass health is, God, I can't keep up. I don't know if it's 20-something billion dollars, of which, again, DDS and mass health are funded through partnership with the federal government. 50 cents of every dollar for all the eligible expenses are paid by the federal government. But look at this language. It gets really, when you're looking at the state budget, it can get really painful. And in our case, by the way, we've argued for line item language like this, where we've said, okay, you can't cut this specific program. We did that with adult foster family care 2.5 years ago. And one of the, the branches put it into the budget. I forget which branch, probably the Senate that year. And then the House accepted it. And that was in the budget. They couldn't cut it past a certain amount. So it's an ongoing, you use every channel you can to try to protect the budget because it's people's lives. Again, it's 11,000 people are served in day habilitation, maybe actually more recently, I was told by the chief we had on last week that it's closer to 10,000 these days. There's 10,000 easily in day services. So if you, sometimes people are part-time in those services. You have, 8,000 people, but under 9,000 in residential, and then you have another about 1,000 people in, you have 7,800 people in provider homes and residential services. You have about 1,000 in state operator homes. So that gives you the 8 to 9, almost 9,000 people in residential. So we're talking about thousands of people, not including, 12 to 14,000 people that are helped through the range of family support programs and through Autism Omnibus, the total's over 1,000 now, and it will grow every year. There's no question about it, So if we can, let me just do one more thing. I want to, the federal state partnership. So how does the state pay for this? Well, number one, your taxes, right? That's sort of the bottom line. Our taxes make a difference. Here's the way they make a difference. We're talking about billions of dollars of services. By the way, I'm not talking about healthcare yet, right? And nor will I, because we're talking about long-term services and supports. So just think about the investment. The partnership with the federal government is vital. And even our states, what's state plan services like medical, rehabilitation, the day have, all those I was just talking about, nursing homes, they're all underwritten through demonstration waiver, 1115 it's called. And we're not going to get into that today, but there are 2 demonstrations going on as we speak. One Care, which is for people on Medicare and Medicaid, and for about 1 million people just recently, 4 years ago, went on to what's called Mass Health Innovations, which is through healthcare entities that they're served. Some our constituents opted out of both of those. We have a lot of constituents that would qualify for One Care because of their Medicare and Medicaid. Finally, we have what are called 4 home and community-based waivers for those for adults. Let me clarify, 3 for adults, then there's the autism children, and then there's actually another waiver that I'm not going to get into, but there's 3 different waivers for adults with intellectual disabilities, regardless of whether they have autism, cerebral palsy, whatever they're defined, Williams syndrome, they're defined disability, and they're geared at different levels of funding need. And then there's also the children's waiver, autism children's waiver that's been around for years now, 2008 maybe, which provides for kids up till 7 years of age. And many of those kids end up in the DESE, Department of Education, Elementary and Secondary Education, DDS program. So that federal money comes to the waiver, you don't really see the difference. If you were getting services, all that money the feds, that's basically a payback to the state. You're getting your funding through the state, but advocacy at the federal level is really important. And again, these are, I share the names of the adult waivers, and I'm worried about time because I really want us.
Yeah. Hey, Leo, we do have a couple of questions.
Yeah, and Carrie, I can round this up. Next time I'll talk about the chart and the services, and then talk about, you'll get in the PDF ways you can do more homework on this as well. Go ahead.
Okay, so Nancy was saying that, asking if you could address any advocacy for increases in funding and support for those found who without intellectual disabilities, but by DDS, but they're right on the cusp and really need more support than they've been offered through the autism only category for adults. And how does this impact no funding through DDS for this population regarding community residential? Many need this support.
Sure. So the bill, which I don't have the number in front of me. That's the bill I was talking about, which would broaden eligibility for that program. And we did, we're on the list of supporting that bill when COVID hit. Honestly, and it's going to be the end of the session this year, it felt like, wow, it's going to be pretty hard to increase that funding level. I think probably over the summer, well, now over the fall, what's going to be really important is to think about what would be the tiers of support, Nancy and others, that would be helpful for people that meet this criteria. So like for Autism Omnibus, it's not a traditional residential design. So we need to get together, and we have talked a bit about this with the folks that are leading this, about what are some strategies around maybe publishing some tiers of support so it'll feel less like a budget buster, especially coming out of COVID with legislators and the governor nervous about spending. The other thing we didn't get into today was the workforce salaries and all of that. That's an issue. So go ahead, go with the other questions to them.
Okay, then, Kathleen was sharing a little bit about, they brought their son David home back in March, and they're planning to take him back in January because they can't do it much longer. But they're just wondering about if there's a surge.
Carrie, you still there? Can you guys hear me? Let me look at the chat. I know people can hear me. Somebody can chat yes, because I didn't hear.
Yes.
Carrie. Okay, thank you. Thank you. So yeah, I think that's a big deal. Okay, I mean, obviously, and the potential of a surge and the funding situation. I think I don't have a crystal ball. We just got to pray there's no surge. I do think we need a ton of PPE. I think people learned a lot through this crisis. I think we got to make sure the staff stay in their jobs, those in the homes. And we also need to figure out people who have loved ones at home that need additional support. How are we going to make sure that happens? So we need on-demand testing, and we need PPE, and that's, hopefully, Massachusetts is coming out of it a little better, but I do think we have, it's tough, right? Carrie just told me she just lost her internet. So I'm going to look at the chat myself. So I do think, Kathleen, I think it's an issue, and I hear you, and it's an ongoing thing, and I don't know. I don't have a crystal ball on the vaccine either, but we have to really make sure, that we get reimbursed. And then to everyone, Beth explained about, so if it's $27 billion for Mass Health and reimbursed 50 billion. Well, that's so. I think, so this is an argument I got into with the Republican legislature, what Beth is raising, the question. The DDS budget is $2 billion, and we don't get quite 50%, but I would think Mass Health is the same as it is with the DDS. The dollars from Phil, if you go and look at the budget, 1 year when our budget was whatever, about 40%, 38% came from the federal government. It was there as revenue. So no, if the budget's $27 billion, it would be more likely 13.5 billion or 12 billion coming from the federal government. Now, ironically, Representative Winslow and I had a debate about this some years ago, but it's sort of his position, which was 54 billion, didn't make sense to me, because when I looked at the DDS budget, I would see the revenue from the federal government being, obviously part of the budget. Does the budget for family support, respite, and families include the budget for AmeriCorps? No, only if the state contributes to AmeriCorps. So so, and probably wouldn't come out of that line item. If it did, that would be very interesting. It probably should come out of day employment, or it should come out of, unless it's a family support program, then it would be legitimate to come out of the family support line item, the matching money. So I know there's an urban core and there's a summer core through DDS that's sort of like AmeriCorps. So to the extent the state participates, otherwise it's federal money and grants, or money administered through a nonprofit or the state that comes to the federal government. And that's different than the Medicaid matching. That's like a whole different amount of money. And the census helps us in those areas like healthcare, not Medicaid, but healthcare, other healthcare, and education, states' education programs. And it helps in terms of affordable housing, those kinds of things. And then the question for Marilyn is, how can we get DDS to provide services to day program participants who live at home? Yeah, so we're working on, okay, so basically the $1 million question or multi-million-dollar question for Maryland is, how can we get day services for those that are at home during the shutdown? And like Maryland, same with, was it Kathleen, and I do think that's essential. I think A, you've got to feel comfortable having someone come to your house. B, we need PPE, so we're not waiting till there's a positive diagnosis. And so it's really important to get the PPE for the public at large that does get in-home services, whether maybe it's at a fire station, maybe it's somewhere where people can access it, maybe it's at a community provider in your community. But the key is minimal contact, being able to pick up the PPE. Again, I'm thinking of the surge that we supposedly will get in November. It's really important to have that and to have those kinds of things. It's a little matter. And then finally, the vaccine, being able, not the vaccine, I'm sorry, that's probably half a year to a year off. I would say the on-demand testing. So, so we're in the middle of negotiating. Today, we'll find out some things about day financing later today. It won't be public for a few days after that. But what is on the table is negotiation about in-home, some kinds of services to get reimbursed at a reasonable level. And we'll learn more about Budget Basics Monday when I talk about breaking down program budgets and how John, who's in the day program, he's with 5 or 6 other people. When you get the in-home services, it's not like all those 5 or 6 people, there's money for each of them to get a week's worth of services. And we'll talk about that and how it works, so you'll be more informed about the budget. Okay, so, and yes, I think people should, those getting funded, you can transfer anytime to participant-directed services. And Herb asked that question and made that point, so thank you. So we're working on it, I'm telling you, we're working on both. They're into the remote, that's on the table for the future. What's not figured out yet is funding for in-home person, Diane. So that's what we're working. So I got to stop it here because I've got our guest and I want to introduce, oh, Carrie, awesome.
I'm back, sorry, I was kicked off the internet. So yes, I was going to mention, it's 12:30, so we should probably bring on our new guest.
So Carrie trained me well on the chat, so I just want to say, so we're gonna skip this. Things are still stable, so I'm gonna skip over this. Okay, you'll get it. So I want to welcome. This isn't Chris or Sarah, but it's a picture from LifeWorks ARC. I want to welcome Chris and Sarah. I had written out the bio. Chris has been. Sarah's had a long career in a number of agencies, but she's been at LifeWorks, and Sarah, I should have written it down, but at this point, I think for at least 5 years, right, Sarah? And now you've become their Vice President of Employment and Day Sports at LifeWorks, while Chris Page, who I've known for a long time, in fact, he helped with the big rally, Peter and Paul and Mary, right? Remember that, Chris?
Oh, I remember that very well.
He's the Chief Operating Officer at LifeWorks ARC. So it's a pleasure. You guys opened last week. You had been open on employment.
Welcome to the meeting.
Thank you.
Thank you.
Yeah, cool. So I would love for you to kick it off first in general, Chris, and then Sarah, you've had employment services going on for a while. I know that. So, group employment started a few weeks ago, right? Beyond essential workers that you've had working all throughout.
Yeah. So on, first of all, it's great to be with everybody today. And I'll just hit a couple of points here and I'll pass on over to Sarah. But on March 17th, LifeWorks and the ARC of South Norfolk, we closed all of our day programs. And at that point, I think like everybody else, we were kind of wondering how long this was going to last and what we were going to be able to do. So what we started doing was about, in May, I think it was probably the beginning of May, started meeting as a group to discuss what we called our Going Forward Committee, which was headed up by Sarah, to kind of discuss some of the things that we thought we would need to have in place. And one of those big ones, and Leo's talked about it, mentioned it a couple of times, is the PPE, having masks and gloves and shields and everything like that. So we've been trying to purchase and purchasing as much of these things as possible. So one of the things that we did during this time was we had to have a point of contact we just have one person who's now in charge of really commandeering and getting as much PPE as we possibly can. And when people need it, we get it out to whether it's a day program or residents. And that was a big part of what we were trying to accomplish, is making sure that we could keep everybody safe. During that time, and I think it was probably about maybe the beginning of July, the end of June, we got a little bit of guidance from the state around what it would take to reopen the program. So we decided that we had been working on this anyway, and we opened the programs on the 20th of July. I think at this point, when we talk about the program, since I mentioned LifeWorks in the Arc of South Norfolk, we are going to become one organization as of October 1st. So we'll just talk of it as such. But it affected about 400 people between all of the programs, all the day programming that LifeWorks provides, which is, we talked about the employment and day, but also the CBDS piece. And of course, Day Hab, which is a big piece of that as well. So, Sarah, I'm going to turn it on over to you, and you can talk about a little bit more detail on how everything's been going.
Absolutely. So as Chris said, you know, all of our lives were turned upside down in March. And, you know, we had all of these folks who, you know, we love seeing every single day, and we just, all of a sudden, there was this void, and how are we going to continue to provide supports and those necessarily, like, points of contact that really, you know, enrich all of our lives throughout the day, because it gets awfully lonely. So immediately, you know, we started planning on our virtual curriculum, and how were we going to do that in the meantime, and we were able to get that up and running rather quickly. We do about 3 to 4 hours a day of virtual programming still, even after opening, because we recognize that there are a lot of folk, everyone has different circumstances. You know, some folks would like to wait it out a little bit longer. Other folks, maybe, you know, the medical fragility just doesn't, you know, have them coming back just yet. And so we wanted to make sure that we were still remaining a constant there. And so that really took on a life of its own. We have about between 20 and 40 people join each one of those classes every day, depending upon, like, cooking is really a hot topic, and Zumba and some of those other more favorited activities. And so that's what we had continued doing for the longest time. But then when we did get that guidance, we, you know, really started looking at what we could do to you know, manipulate the building, the rooms, to really bring people back in a safe atmosphere that everyone would feel comfortable at, staff, individuals, families, if they wanted to see it. And so, you know, brought out those tape measures and really moved furniture around and put a lot of different things in place. We have classes now that incorporate that virtual element, and we actually, the folks at home can see the folks that are here in the building, and they can have a class together like they would pre-COVID, which has been really awesome. We, you know, as Chris said, with the cleaning and the PPE, like, there were, probably about 40 new protocols and policies that we drew up and implemented, because that's the most important part here, just to make sure that everyone was safe and everything was clean. We got an additional cleaning crew involved to make sure that everything was as spotless as possible throughout the day. And so with all of that, you know, the different buildings there's 4 different locations that we're talking about, 2 for the Arc and 2 for LifeWorks. And of the people who are coming back, because we did do like staggered schedules, you know, some folks are coming only Monday, Wednesday, and Friday, and Tuesday, Thursday, we're doing the hybrid Zoom schedule because that's what worked for their lives. I would say that we're helping about 60 to 65 people right now, which isn't really bad for week number 2. There are a number of people who actually never stopped working, so we did continue to provide those job coaching supports, because that was really necessary. A lot of those jobs were, you know, grocery stores and places that had to implement new protocols off the bat, and we wanted to make sure that we were there to help get people acclimated, and that was pretty successful. We also did have...
Sarah, a quick question.
Yeah.
60 people coming in, is that both the rehabilitation and the CBDS and all that, or?
Yes, yeah. So, you know, the different locations, everything was dictated by square footage on how many people that we could have in the building, and that does include staff. And so we had to really sit there and think about how we're going to make, you know, dynamic schedules that would be fair for everybody, but yet meet everybody's unique and individual needs, which was definitely probably the most tricky of all the tasks, which actually came from a survey that we sent out to find out where people were at. What were your priorities? What, you know, were you looking to come back day 1, or, you know, 2 to 4 weeks after, or even longer? And so we took all of that data in and digested it and really tried to use that information to make the schedules for people.
Great. Great. Sounds pretty complicated. Did I cut you off from, I didn't mean
I think I was just going to mention the group supported work site. We did have one that actually started back before we opened the facility doors. And we worked heavily with that actual, that company to find out what their protocols were. And as we're going to do when we reintroduce each one of these sites. Just to, prep people, make sure everyone's, has the same expectations. That crew has been back close to 8 weeks now.
Wow.
And it's been very successful. In working with that company too, they've been very supportive throughout the whole process and made sure we had the space that we needed and all of that. And we do anticipate another one opening in about a week and a half, and then a third early September.
Wow. So amazing. So they're dealing with space issues too, where people used to work in groups, and that's challenging. And did a lot of people lose jobs that you're now having to refine, do job searches? Not immediately, obviously, it's a tough time to be doing a job search right now, but, percentage wise for the people who are individually employed?
For us, we've been pretty lucky, and that hasn't been the case because coming out the gate, our case managers were communicating with those different places of employment. And if somebody chose to take this time off during COVID, we made sure we got the paperwork in, whether it be, for FFCRA or something like that. So we did the best we could to work with those employment options. So nobody has lost a job yet, but this is the time where, a lot of places are recalling their staff. And so it is on our minds to make sure that, we're helping people through that process.
Great. Carrie, there's a question in the chat, I think, for Chris and Sarah. Is there or no?
I don't see one.
Okay.
I don't see one, no.
All right.
I would like to mention just one thing quickly.
Please.
And Leo, when you opened up with this, you talked about that we've been working all along, and we have, because there's been people that, as Sarah mentioned, that were working and needed that support. So I just have to say, we're very fortunate to have the very dedicated staff that we have that have been out there throughout this whole time, working with folks to make sure that they're able to keep their job, get to their job, get home safely. So I just wanted to throw that in there, that a lot of people have been working really hard on this through this whole time.
I do see a question.
There is a question from Suzanne. She's wondering about the guidelines regarding social distancing. She's heard a couple of different things. Is it 6 feet or 113 square feet?
So do you want to take it, or do you want?
No, I have a vacuum outside my door. You can go for it.
So for the programs, it's the 113 square feet per person is what we have to go by. But 6 feet is in general what you hear. And I know there was some formula to come up with that, which I think equals the 6 feet. Is that correct, Sarah, in the social distancing?
Like the radius of.
Yeah.
So the building was determined. We would have to go and find out the entire square footage for the building and then divide that by 113. And then that would tell me how many people could be in the building safely. But that's just the global look at it. So then I had to look at each individual room, and that's where the 6 feet come into play. So it's kind of both.
I think if I can just add to that, if you say you need 6 feet between you and someone else, that's 6 feet. But if you say that each person needs 113 square feet of their own personal space without an overlap, then that's basically 12 feet apart. And I think that's where the confusion is coming in.
That makes sense. And our tables, or when we moved furniture around, we did have to think about that, because people don't realize that 6 feet goes diagonal in all these other directions too. So you're 100% right that it was confusing. The 113 was really just to help us determine how many people could be in the building, period. And then we had to look at each room individually on how we would safely be able to put people in each room. And that's where the social distancing guidelines of the 6 feet came in.
Great. Well, I'm going to be good. I can't believe it. I know there's more questions I want to ask, but it's 12:45, and I want to make sure people come back next week. But Sarah and Chris, it was very enlightening. If people have other questions down the road, we can have you back. I just think the immensity of what you had to do. I mean, when you think of the different levels, there's the building piece of it. There's the what do people need. There's the outdoors part of it with other businesses, right? They're staying in touch with not only the businesses, but the people you serve. I mean, it's been such a challenging time, and you should be proud that you have so many people back, and the jobs that hopefully will still be there. So thank you for all the hard work you guys are doing out there, and to your team and the other teams that are out there across the state. Thank you. And thanks for coming on short notice, and really appreciate it.
No problem. Thank you.
Thank you for having us.
Everybody have a great week. Tomorrow, Kerry has, I know, something good. And what is it again, Kerry?
Yeah, so tomorrow, I hope you can join us. We're going to be doing a focus group on long-term support services and a follow-up from Whitney Moyer being on with Leo from Mass Health, and just what's going well, where are some of the hiccups, trying to get some information out there. And if you speak Spanish, we're going to also have rooms that will be interpreted. So you're welcome to come. And then on Thursday, Maura is welcoming Russell Johnston from the Department of Elementary and Secondary Education, and he's going to be talking about reopening in schools. So it's a full week, and hope you get to join us. So thanks for coming on today.
Yeah, and those are at 11. So Kerry, thanks. You once again for all you do, and appreciate it. Thank you, everybody.
You're welcome.
Have a great week. And
also send me the link also too.
Will do, Jared. Take care. Have a great week. Bye-bye, everybody.